It's coming up to 21 minutes after 10 o'clock. Thanks for joining us here on ENCA. Now, lockdown level 3 came with a lifting of the ban on alcohol sales to the delight of consumers and business alike. However, President Cyril Ramaphosa then reinstated the ban almost with immediate effect. He cited an increase of patients in the trauma units amid COVID-19 pandemic. Was this a good enough reason, considering the billions of rand in tax losses and the threat of job cuts in the sector? Well, I'm joined now by Professor Leslie London, Head of the Public Health Medicine at the University of Cape Town, Maurice Smithers from the Southern African Alcohol Policy Alliance. He's a director there. And we also still have with us Mary Makgaba from POWA, where women opposed to women abuse. We are hoping as well to establish a connection with a representative of the liquor industry, like Ntimane. Shortly, he'll be able to join us. Prof. London and Mr. Smithers, thank you very much for being with us now. And Mary, thanks for staying on. Prof. and Maurice, before I get going, I just need to let you know that earlier I interviewed Mary. She's with us, and she's of the view that there is a direct correlation with the availability of alcohol and abuse of women. Can I start with you, Maurice, from the Southern African Alcohol Police Alliance, SAPA in South Africa? A few weeks ago, you wrote an article where you said you would have preferred to see both the ban on liquor and tobacco continue under level 3. Are you still of the same view?
I don't think we said that. I think what we said was that we understood the reason why government had imposed a ban. We hadn't expected it, but once it had been done, we could see the value of it. But what we have said, and I think we would agree with Professor Charles Parry and the MRC on this, is that the ban, a long-term ban, is not sustainable for a lot of reasons, including the economic consequences, as well as some of the criminality that is happening around alcohol with the underground market. So we believe that we should move into a phase where we have stronger restrictions around alcohol, which can then enable the ban to be lifted and for economic activity to resume, but in a safer alcohol environment. And that's kind of what our position is.
We'll try and explore what a safer kind of environment would look like. And Prof, I mean, one of the reasons given by government for extending the ban on alcohol sales was that there's a threat to the healthcare system in terms of trauma units. We see a rise, especially at the weekend after people had been drinking, of people who flocked to the hospitals, and that put pressure on the system that's currently battling to deal with the coronavirus.
So that is absolutely true. The extent to which the ban has lifted the pressure on the hospitals varies. I mean, there's data which suggests it's anything between 20 and 80% of trauma cases were, in a sense, prevented because of the ban. It's interesting that the initial ban produced a massive drop in trauma cases. The subsequent ban, which was only for alcohol and not for transport, so we didn't have a complete lockdown, produced a similar order of decline. So it's not just the fact that people were staying at home that reduced injury. It was very much linked to alcohol. Of course, as Maurice says, and I agree, it's not sustainable in the long term, but it does show the link between easy alcohol availability and trauma with the impact on the health services. The fact that they're now really coming out of a very peak period of COVID means perhaps different kinds of decisions could be made, but I think the evidence is very clear.
Now, Mary, from POWA, when you hear that it might not be sustainable to continue with the ban in the long term from an economic perspective, how do you respond to that when you as POWA are of the firm view that alcohol is not good at all because it does lead to increase in cases of abuse against women? How do you respond to that?
Yes, there is a strong correlation and a strong link for alcohol abuse, which perpetuates gender-based violence. But however, remember, people who are working at South African breweries, those who are manufacturing, those who are selling, there are also staff members, people who are employed. For economic reasons, the other way around. They need to be employed. They need to go to work, just like other sectors that are open. But I'm of the view that though it cannot be done, the ban cannot be on a long-term perspective. It is very, very imperative that, for instance, if there are strict regulations pertaining to the use of alcohol, maybe if they lift it, maybe in terms of operating hours per person, how much beer to buy, and so that there must be monitoring. I'm not sure if the SAPS could be able to do that, because if there is no proper monitoring, they just open, everybody goes there and then they buy at different times. Heavy drinking perpetuates domestic violence, particularly physical abuse and sexual abuse. I'm of the view that, yes, for economic reasons, partially I agree, because some people are employed by South African breweries, manufacturers, and those that are selling alcohol. They are now at home and there are no relief funds to assist their families to survive in terms of meeting their basic needs.
Yeah, there is currently a campaign called #SaveMyLivelihood, which is being run by the industry, the alcohol industry, who are arguing that as well the alcohol ban will increase poverty, hunger and mortality rates in the very communities it aims to protect. I'll give some details about that #SaveMyLivelihood at the end of the show for those people who are interested. But Mr. Smithers, you were saying that there could be a way where this could be done in a safer environment where it's possible, and Mary is saying that maybe there should be more restrictions. Is that a kind of a safer environment you would envisage?
Yes, absolutely. I think, the critical thing that we need to understand is that alcohol is a drug. Like any other drug, it just happens to be a legal drug. So the responsibility of there are three players, really, that are responsible for ensuring that we have an alcohol-safe environment, and that includes government as the primary regulator of the country. It includes the alcohol industry itself, and it includes the users. Now, the liquor industry likes to put all the responsibility on the users, so they run campaigns called responsible drinking and so on, as though the problems of drinking is simply bad behavior by individuals. We are saying you need to understand the environmental context in which drinking takes place, because drinking itself doesn't necessarily have to be dangerous, doesn't have to be dangerous to women or to anybody else. So we're arguing that, first of all, we should follow the World Health Organization recommendations, which is to reduce availability, to increase the price of alcohol, and to ban or severely curtail alcohol advertising. Because those three things together, and this is a globally accepted set of guidelines, those three things together will actually help to create a safer drinking environment. And by a safer environment, we mean for drinkers and for the people around drinkers. So that could include, as Mary has said, limiting operating hours. There's no reason why liquor outlets should stay open till 2 or 4 o'clock in the morning. It includes reducing the number of liquor outlets that we have. Yeah. It includes increasing the age of drinking from 18 to 21, which is already proposed in the Liquor Amendment Bill of 2017. The question includes maybe having smaller containers. We have, for example, beer being sold in 750 and 1 liter bottles. Now, once you open a bottle of beer, you've got to drink the whole thing. So reduce the size of containers that you have.
Okay, you've suggested
and
a number
as Mary has said,
yeah,
reduce the amount
of alcohol,
the amount of liquor that people can buy.
Okay, Mr. Smithers, you've raised a number of suggestions there. We'll carry on to explore some of them shortly. You stay connected. And of course, just to mention, we did reach out to the Department of Health, the government. We tried to have a government representative on this discussion this morning to get their sense and view how successful the alcohol ban has been so far. But they told us that they won't be able to join us because there are court cases pending around this issue of the ban of alcohol. We wish to have had them here, but unfortunately they've declined our invitation on the basis that they are dealing with this matter in court. We will continue our discussion on the suspension of the sales of alcohol shortly. Stay with us.